chemical acaricides. That these are the chemical groups. Organochlorines, don't get it organochlorines, but still the organochlorine formulations are available in the form of a cream. BHC cream is also available. Organophosphates, then carbamates. The carbamates, carbaryl is a powder which is used for dusting. If you are using organophosphorus compound, this should be the concentration for the use on the body, and in the premises, you should have a double concentration. Now I am talking about all kinds of ectoparasitic infestation, ticks, lice, fleas, and also mites. Then, as I've said, pyrethroids, they should be used because, the distinct advantage of pyrethroid is that it is a water soluble, so the solution can be prepared, and then the pyrethroids have a knockdown effect. As soon as the arthropods or the ectoparasites come in contact with the different types of pyrethroids, they die immediately, because basically pyrethroids are the contact poisons, and these are the concentrations you should use it on the body. And one more pyrethroid is a flumethrin, which is available as a pour-on formulation. Even permethrin, pour-on formulations are available, and the formulations which are now available in the market, you can use it at the rate of say 1 ml per 10 kg body weight, and you have to just pour it along the back line. It gets absorbed, and then it exerts the acaricidal or insecticidal effect. Propuxar is also quite popular, and it is available in the powder form. So whenever the compounds are available in the powder form, you can use it for dusting. Then ivermectins, like ivermectin, doramectin, moxidectin is also available in a pour-on form, so that can be used. Formamidins like amitraz should be used sparingly. Then phenylpyrazole, fipronil, it is pretty expensive. This product is also effective. Then salicylanides, which is basically anthelmintic, endoectocide. So closantel can also be used at the rate of 10 milligram per kg. Or I have come across one or two references using closantel dip, like 6 ml per liter of water, but it is pretty expensive if you use it at that particular rate. So what are the methods of insecticide or acaricide applications? You have a dusting, then dipping, spraying, and a systemic use. In dusting, when it is available in the powder form, you can use it. You have to use a brush, okay, so that it is evenly spread on the body. So there is an ease of application. It is less tedious, but you may not achieve a uniform application. So some pockets may remain untreated and the efficacy may go down. But at the same time, there are less chances of toxicity. So I would say if the infestation is very light, if you have spotted it for the first time, you can go for dusting and try to control it by using different types of powders like carbaryl or propuxar. But if the infestation rate is high or moderate and large number of animals are affected, then for mass treatment, you can use a dipping method. So the dips can be constructed, or even I have seen the tubs can be used for individual dipping. The advantage with this method is that there is a uniform application. The entire body becomes wet because the animal takes in a dip and then it comes out. But as you go on passing the number of animals, the concentration of the acaricide or insecticide goes on reducing. So a concentration gradient is formed. And that is why, depending upon the size of the dip, you can pass say around 50 animals or 75 animals. And after that, the dipping solution has to be changed because the concentration goes on reducing. But in dipping, there are chances of toxicity. There are certain prerequisites for dipping. You should provide adequate drinking water for the animals so that they don't drink the insecticide solution. So the care has to be taken. Spraying is comparatively better, and for treatment of a smaller group, spraying can be used at the same concentration. And I came across one particular reference giving a systematic plan for spraying the body. According to that particular reference, you should start spraying on the back line first. then followed by on either sides and the flank region. Then you come down to legs, outer portion of the legs and inner portion of the leg. Then the underside of the body, thoracic region and abdominal region, maybe up to scrotum or the udder portion. So the underbelly is treated. And at the end, tail and head should be treated. So a definite scheme has to be followed so as to ensure that there is a uniform application. And what I feel that, if you treat the head first and if you then go on treating the other portion, then the chances of toxicity is more. So head at the end, and then, the animals are let loose so that, you can monitor also properly. Then in case of systemic, there are tablets available, injectables are there, pour-on methods are there. So pour-on methods are a very user-friendly method, very easy to, but there may not be equal distribution. Sometimes there is a question of bioavailability of the compound at different portions in the body. So these are different methods one can use. Now, this chart shows the modes of resistance to different acaricides. And basically, you will find organophosphorus compound and pyrethroids. And this is mainly by Rhipicephalus microplus or Boophilus microplus, which is a very, very common tick in cattle. Now, some of the tick, they are common between large ruminants and small ruminants. So acaricide resistance or insecticide resistance is a big problem, and more the reason you should use these acaricides very, very sparingly. So parasites is not new. Since last so many centuries, they are existing. Started with vengeance, to eradicate them, to destroy them completely. But, we could not achieve this. So then we concentrated on controlling these ectoparasites. Even we could not control effectively. So we are now, targeting, or we are trying to manage these. Probably, if we manage these ectoparasitic infestations nicely, we will be able to control them. Certain common mistakes in using pyrethroids. So what are the common mistakes? First is you are reconstituting the working solution under sun, because you will realize that these pyrethroids or even amitraz are available in the amber color bottles or a metallic bottle, so as to protect them from the sun rays. And if you are reconstituting in the open sun, then there is a possibility of detoxification, or the potency may come down. So always reconstitute it under the shed. Then once you reconstitute it, the dilution, that is 75 ppm or 100 ppm, you have to use it immediately. You can't keep the solution for use for the next day, because it is rapidly detoxified. It is of no use. You have to use entire reconstituted solution within next 2 to 4 hours. Then sometimes, the well water is used, hard water is used, then the potency goes down. You have to use tap water, for reconstitution. There are a few references stating that if you use a lukewarm water, when the temperature of water is say around 40 to 45 degrees centigrade, and then you mix the pyrethroids, then the potency is good or the efficacy is also good. So these are some of the tips which you can practice in your day-to-day treatment protocols, and you will get a better results. In case of mechanical removal, deticking, when you use it, you remove the ticks, and if you throw it on the ground, the ticks, without destroying them, then those ticks are going to lay eggs. And then with one tick throwing down, the level of environmental contamination within next 1 month. The level of environmental contamination would be around 10 lakhs of larvae if you just throw one tick on the soil. So the ticks should be destroyed, squashed, or you can put it in the kerosene, or you can put it in the liquid of pyrethroid, then destroy them. So these are some of the common tips. If you use it, you will be able to control the ectoparasitic infestations more efficiently. When you are using these acaricides or insecticides, when you use particular compound for treatment of ticks and mange, it is known as acaricide. When you use it for insect, it is known as insecticide. So when you are using it for lice, the topical application is really good. It is very efficacious. You don't have to go for systemic because, as I've said a number of times, that these lice, they feed on superficial epithelial cells, biting lice or a dandruff. So if you use a systemically, the drug may not reach the ectoparasite. Okay, or even the sucking lice also, they take superficial lymph. So the concentration of the drug in the lymph may be very less and you may not get the desired effect. So for treatment of lice, it is always better to use a topical application. While in case of mange, it is exactly a reverse position. You can use it particularly for sarcoptic and demolytic mange. Systemic use of acaricide is recommended because these are burrowing mites. While for Soraptis, yes, even if you apply locally, it will have some effects. But for a burrowing mites, it has to be a systemically used acaricide. Then for control of lice, shearing, if you do it and then you treat it, then there is an effective control because with shearing, 80% of the population can be eliminated. There are some, situations where long wool is also treated, but then the number of applications are more. Then the remaining points are same, that cleanliness has to be maintained, disinfections of the farm application for both these cases. The only difference in case of mange, number of treatments are required and the assessment of the clinical, the treatment should be there by two ways. One is a clinical examination. You can see that the lesions are healing up. And second is keep scraping and examine for the presence of mites. Resistance in case of mange is not reported. Although for ticks, the resistance has been reported, but for mange, the resistance has not been reported. And then for mange, the supportive therapy is very important. For example, if it is a sarcoptic mange, you have to give some anti-allergic medicines. Even in extensive cases, you can use steroids. Then if there is a secondary bacterial invasion, then you can use antibiotics. You can use antihistaminics. So supportive therapy, you can use minerals and vitamins for a proper healing of the skin. So supportive therapy is required in case of mange. Then a number of treatments are required. While in case of lice, the number of treatments are comparatively less. Supportive therapy is not required. And the other aspects are same. These lice or mites, they can live away from the body of the animal for not more than 2 to 3 weeks. Then cleanliness, disinfection is very important. Desiccation is lethal for both these groups of ectoparasites. And if you apply all these steps, you can also cover or you can also control Melophagus ovinus, which is known as a sheep cat. My suggestion, my recommendation is that when you come across the ectoparasitic infestation, tackle it at the first instance. This is the point where the treatment is very easy. If you allow these ectoparasites to multiply in the particular flock, then the treatment becomes very, very tricky and tedious. As far as possible, your treatment should be eco-friendly. So try to develop a IPM module, like, deworming schedule. There is no uniform deworming schedule. Likewise, you have to develop IPM module in your area, in your region to treat it and minimize the use of these chemical ectoparasiticides. And that is how you can control these different ectoparasites.